Lupus is an autoimmune disease meaning the immune system doesn't function properly and attacks a person's own body by mistake, and it affects multiple organs throughout the body. In fact, lupus, systemic lupus erythematosus, is a long-term disease that can cause inflammation, pain, and tissue damage in your body. People with lupus produce abnormal antibodies in their blood that target tissues within their own body rather than foreign infectious agents. These antibodies are referred to as autoantibodies. In this video, we're going to discuss lupus and your body. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash that like button and subscribe to never miss out on any of our videos. Lupus is a complex and poorly understood condition that affects many parts of the body and causes symptoms ranging from mild to life-threatening. There are some types of lupus that just affects the skin, such as discoid lupus erythematosus and subacute cutaneous lupus erythematosus. Some medications can also cause lupus-like side effects. However, the term lupus is most often used to describe a more severe form of the condition called systemic lupus erythematosus, SLE. Systemic lupus erythematosus is the most common and serious type of lupus. It affects multiple body systems, including blood vessels, joints, kidneys, skin, heart, lungs, and the brain and nerves. Symptoms of SLE can be mild or severe. The other form of lupus is called discoid lupus erythematosus, which affects only your skin. When systemic lupus erythematosus (SLE) affects the kidneys, it's also called lupus nephritis. Lupus is an autoimmune disease, meaning your immune system, your body's defense system, which usually protects the body from disease, turns against the body. This causes harm to organs and tissues like your kidneys. Lupus nephritis results in inflammation, swelling, or scarring of the small blood vessels that filter waste in your kidney glomeruli. Lupus is a chronic condition that is long-term with periods of activity and then remission. It's characterized by inflammation which starts on a molecular and cellular level, eventually entering a level that can be seen by the naked eye. There's no cure for lupus, and it's diagnosed based on a combination of symptoms, physical exam findings, and blood test results. Lupus is much more common in women than in men, and most often strikes during the childbearing years. 9 out of 10 people who have lupus are women. Lupus is also more common in people of African or Asian backgrounds. African Americans and Asian Americans are about 2 to 3 times more likely to develop lupus than Caucasians. In the United States, 1 out of every 250 of African American women will develop lupus. People with lupus are at increased risk for hardening of the arteries. This can lead to high blood pressure, heart attacks, and strokes. Lupus can also affect cells in the body. People with lupus may have fewer white blood cells. These cells help fight infection. People with lupus may also have fewer platelets. Platelets help in blood clotting. Having fewer platelets can lead to easy bruising and bleeding. Lupus is the epitome of an autoimmune disease, says Stuart D. Kaplan, MD, the chief of rheumatology at South Maso Communities Hospital in Oceanside, New York. It's the body fighting itself and making antibodies against one's own cells. This lifelong chronic disease has the potential to affect almost every organ system in the body, although not all systems are affected in any one person. The first thing patients need to know is that lupus varies in symptoms and severity from person to person, adds Dr. Kaplan. Some people have active disease while others have mild disease. It's important to note that lupus is not contagious because the antibodies and accompanying cells of inflammation can affect tissues everywhere in the body. Lupus has the potential to affect a variety of areas. Sometimes lupus can cause disease of the skin, heart, lungs, kidneys, joints, and/or nervous system. When only the skin is involved by rash, the condition is called lupus dermatitis or cutaneous lupus erythematosus. A form of cutaneous lupus erythematosus that can be isolated to the skin without internal disease is called discoid lupus erythematosus. When internal organs are involved, the condition is referred to as systemic lupus erythematosus (SLE). Both discoid lupus erythematosus and systemic lupus are more common in women than men, about 8 times more common. The disease can affect all ages, but most commonly begins from 20 to 45 years of age. Neonatal lupus is a rare form of lupus that affects newborn babies. Babies who have neonatal lupus are born with a skin rash and sometimes liver and heart problems. For most babies, the symptoms gradually go away over several months. In rare cases, neonatal lupus can cause a serious heart problem. Doctors think that neonatal lupus might be caused in part by certain proteins in the mother's blood that is passed on to the baby at birth. If you're pregnant and have SLE, your doctor will want to monitor you and your baby for certain complications. Most babies born to mothers who have SLE are healthy. CNS lupus is less common than other forms of lupus and can create numerous symptoms and issues for patients because it reaches out beyond the brain and spinal cord to all other parts of the body. Lupus impacting the central nervous system can cause a number of issues including confusion, brain fog, seizures, changes in personality, or stroke. Lupus impacting the peripheral nervous system may cause neuropathy, damage to the nerves, which could cause numbness and tingling. Lupus of the nervous system is often co-managed by a rheumatologist and a neurologist. CNS lupus is extremely challenging for doctors because there are many other things that may cause issues with the brain or the spinal cord. Due to the complexity of the CNS lupus, a number of tests may be ordered to determine more specific information. A CT scan, MRI may be used to examine the anatomy of the brain to check for abnormalities. Doctors may also use an EEG, electroencephalogram, to evaluate for seizures. A lumbar puncture spinal tap may be used to analyze for infection or inflammation in the spinal fluid that surrounds the brain and spinal cord, and an EMG NCS, electromyogram nerve conduction study, may be used to evaluate for neuropathy. The treatment for CNS lupus varies depending on the symptoms experienced by the patient. No one knows what causes the disease. Your family history and things in your environment, such as infections, viruses, toxic chemicals, or pollutants, car fumes, factory smokes, may play a role in causing the disease. Men and women of all ages and races get lupus. However, about 90% of people diagnosed with lupus are women. It's important to note that cases of lupus symptoms and symptom severity differ from person to person, and new symptoms can appear at any time. Stress may contribute to the immune system not functioning properly, explains Kaplan, and both emotional and physical stress, such as from surgery, has been known to exacerbate lupus. The precise reason for the abnormality autoimmunity that causes lupus is not known. Inherited genes, viruses, ultraviolet light, and certain medications may all play some role. Lupus is not caused by an infectious microorganism and is not contagious from one person to another. Genetic factors increase the tendency of developing autoimmune diseases, and autoimmune diseases such as lupus, rheumatoid arthritis, and autoimmune thyroid disorders are more common among relatives of people with lupus than the general population. When you have lupus symptoms, you're having flares or relapses. When your symptoms get better, you're in remission. Lupus may get worse very quickly. There's no way to tell when a flare will happen or how bad it'll be. When you have a lupus flare, you may have new symptoms as well as symptoms you have had in the past. Learn your body's signs of a flare, such as joint pain, a rash, a fever, or being more tired. When you see any of these signs, take steps to control your symptoms. Follow-up care is a key part of your treatment and safety. Be sure to make and go to all appointments, and call your doctor or nurse call line if you're having problems. It's also a good idea to know your test results and keep a list of the medicines you take. There's no currently cure for SLE, but there are different medications that can help relieve many of the symptoms and reduce the chances of organ damage. With good levels of support from friends, family, and healthcare professionals, many people with SLE are able to manage their condition effectively. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Stay safe, and we'll be back with you in another video.